So the heart can develop problems in any of its systems. The heart, like a car, has multiple systems. You know, sometimes the battery doesn't work and you can't get the car started, even though it's got a great engine and the tires are fine and everything else is working. So the heart has an electrical system, just like your automobile does, and you can have problems with the electrical system that make the heartbeat either too slow or give you extra heartbeats or arrhythmias, even very serious life-threatening ones like ventricular tachycardia or ventricular fibrillation. And you know, we have important AHA programs to deal with those in emergency cardiac care and CPR. In addition, the heart can have a problem with the blood vessels that supply the heart, the coronary arteries. Coronary arteries sort of sit on the top of the heart. They're called coronary arteries because it's thought to be kind of like a crown over the heart, and those blood vessels supply the heart muscle itself with blood. And absolutely, the most common kind of problem with the heart muscle is caused by problems in those blood vessels. Atherosclerosis, it's called, or arteriosclerosis. Problems with often cholesterol deposits and growth in the walls of those arteries that make them less able to do what we said the heart could do so well, that is, increase blood flow that we need it to do. We need it to pump blood out to the body, but it can only do that if the blood flow to the heart muscle increases. So coronary artery disease is very important. In terms of numbers of patients involved with a cardiovascular disease, actually hypertension or high blood pressure is the most common. And that will affect as many as 90% of the population if you look at us over the course of a long life. So that's quite important, and it affects the heart in a number of ways. Primarily, it increases the thickness of the heart muscle. So if the heart is having to pump harder to get blood out into a system that has high blood pressure, the heart will try to compensate for that by getting thicker and thicker. Now, you would think that would be a great solution, just like increasing the muscle in your arm when you lift weights and such, but it's not so good for the heart to be thick because it then has to operate at higher pressures, and that can actually lead to problems like heart failure. You can also have problems with the heart valves. The heart valves can either be abnormal when you're born in some forms of congenital heart disease, or they can be just a little abnormal but prone to develop problems as we age. Or you can have things happen to the heart valves that you couldn't predict. Even in a normal healthy person, you can develop infections or inflammatory processes of the heart valves that make them either too tight, so it's hard for blood to get through them, or too wide open when they're supposed to be stopping the flow of blood going backwards so that they can actually leak. So heart valves can be affected in a number of different ways, and again, we have ways to correct that or even to replace valves when we need to. You can also have problems with the heart muscle. Much of that is due to coronary artery disease. If the coronary arteries become blocked, we lose heart muscle, we have heart attacks, for example. But the heart muscle can also be affected by other problems, so that you can develop, if you have a heart muscle problem, the bigger, longer word for that is a cardiomyopathy. That is, heart, muscle, and a pathologic process can be caused by many different things, can affect even people who are young and healthy because of inflammation, viral infections, a whole host of things. And if the heart muscle doesn't pump well enough, then in fact people develop heart failure, or are short of breath and fatigued. Those problems we can deal with medications usually. Sometimes if they're severe and don't respond well enough, even heart transplantation is sometimes necessary to restore people to a healthier state.